I thought I'd talk a little bit this morning. It is morning where I'm at about the difference between manual therapy, what massage is as part of that, and massage therapy as a unique practice. So, massage absolutely is manual therapy. Many occupations that use manual therapy also may use massage. They might not call it massage, they might call it soft tissue manipulation or some other um, term, but it is manipulation of the soft tissues, which is the definition of massage. Now, we're expanded in our definition and our scope of practice with massage therapy to include joint movement, applications of adjunct methods such as hydrotherapy. We can target a physiological function by adapting the way we provide the hands-on approach or forearm. Um, so we can target connective tissue glide or we can target fluid movement, but it's still all done with a application of a mechanical force. And that's what soft tissue manipulation is. So massage is a manual therapy, uh, but it's not the same as it's practiced by other professionals, osteopaths, chiropractors, physical therapists, etc., nurses. They may do manual therapy, but they are doing it in a specific way to target some sort of rehabilitation or pathology treatment or that sort of thing. Now, massage can do that to a certain extent, but our scope of practice puts us in a position where we can do a lot. We can use a lot of different adjuncts. We can use suction cups and tools, and in addition to our massage therapy practice. Um, but the scope is to enhance the health and well-being of the client. Certainly, we deal with situations that people come to see us with that are uh, pain related or stress related or movement related. And depending on where that falls, it may be that we can autonomously work with that person and improve the quality of their life. You might even see secondary to a massage approach, a reversal of some of these conditions with individuals, as opposed to if they are seeing an osteopathic physician or a chiropractor or a physical therapy. That is not just focused on health and wellness and people functioning with a higher level of quality of health. It is focused on a therapeutic change, a treatment of a symptom. And those individuals, those professionals, their education expands their ability to diagnose, prescribe, identify comorbid or other factors that are lifting in or fitting into the situation, and to treat, to specifically treat, and to take the risk with people that are fragile or very complex. Now, a lot of times in an interdisciplinary approach, massage therapy can come in and be an integral part of that as it looks at a broader scope, looks at or a broader application, looks at quality of life, looks at symptom management. But uniquely, we're able to operate outside of a medical system and a medical diagnosis and a medical treatment. We are able to be part of a person's whole person care. They don't have to have a diagnosis in order to see us. We are a part of staying well as helping an individual manage things like stress or pain. Once that has been diagnosed and understood, we're a very important part of the management of that. Enhancing mobility. I worked a lot with professional athletes over my career, and they have athletic trainers and strength and conditioning coaches and an entire medical team that works with them. I would work with the consultation and recommendations. I would support what they were doing, but I was the only one that provided a therapeutic care that worked with the whole body, and worked with outcomes that had to do with res restoration and condition management as opposed to diagnose and treat. So massage therapy is very unique in that we work with people that are not only dealing with some sort of an issue, but people that want to enhance their quality of life. And so the general massage protocol that sifts through all the tissues and moves all the joints and looks for what's working well and supports breathing and cleans up a little something here and relaxes something there. And that's an essential part of self-care. And it's done for the person as opposed to them needing to be an active participant. And certainly they can be with massage, but it's different than like going to an exercise class or focusing on meditation, although there are very, very similar outcomes. So I want to show you some definitions that were pulled together by Ann Blair Kennedy. So I'm going to share my screen that open and look at a little bit of this type of information in the new edition of Fundamentals of Therapeutic Massage. So let's see if I can actually make that happen. All right. What we have here is something called this is in chapter 1, the Massage Therapy Practice Framework. And so understand that massage is something that everybody can do. We massage our babies, we massage our pets, we massage our friends with a form of touch, but it's not a therapeutic application of touch, but it's still a manipulation of soft tissues. So this particular part of the textbook presents a massage practice framework that was done by Ann Blair Kennedy. So these are the definitions she put forth. Massage is a patterned and purposeful soft tissue manipulation accomplished by the use of digits, hands, forearms, elbows, knees, and/or feet, with or without the use of an emollient, liniments, heat and cold, and handheld tools. That it often in the scope in licensing it is handheld tools that mimic the action of the hands or other external apparatus for the intent of therapeutic change. Okay, I think that we can agree on that. But let's look at massage therapy. Massage therapy consists of the application of massage and the non-hands-on components, including health promotion, educational messaging, self-care, health maintenance, therapy, as well as outcomes can be influenced by therapeutic relationships, communication, the therapist education, skill level, experience, and the therapeutic setting. And if we look at a massage therapy practice is a client-centered framework for providing massage therapy through a process of assessment and evaluation, plan of care, treatment or intervention, reassessment and reevaluation, health message and documentation, and closure in an effort to improve health and/or well-being. Massage therapy practice is influenced by the scope of practice and professional standards and ethics put forth by the state or another credentialing bureau. Okay, let's stop the share here. So uniquely in a health profession, we can function autonomously. We can create a health and wellness therapeutic practice process for clients that doesn't have to be treatment oriented. Evidence-informed outcomes include relaxation and well-being, and then stress management, pain management, and supporting mobility, functional mobility. All of these can be integrated with a medical approach as support care, and they can stand alone in general wellness care for a client, which is where we operate the best. This is with, we have ongoing care of the client. We see them on a regular basis. We monitor, what's going on with them from session to session. The environment, the familiarity of the location and what linens and blankets are used, and the professional appearance of the massage therapist, and the music, and all of that is part of a total person approach to care. And all of those elements are therapeutic. All of them support the foundational outcome of relaxation and well-being. So, I think massage therapy in some instances has pulled itself into two camps. One, which is the manual therapy, quasi-medical approach, where you're looking to find through assessment something that needs to be addressed, and you want to provide an intervention that is going to cause a shift or a change towards a more efficient function. Absolutely. So there's that. And then there is the whole person wellness care approach. You can combine both. They can be there in both situations. I recall Dr. Brent Bauer and an approach that they had been using or used at the Mayo Clinic. They realized the importance of the relaxation environment. We want to call it the spa environment, quickly moving to a wellness center concept. But the ambiance was important, and the wholeness and the reliable beginning, middle, and end of the session was recognized as important. So they converted an area in the hospital into a spa and engaged in all of the different elements that come into that. And the historical spa is a healing center. It has always been, until recent history, it has always been about helping through variety of methods and modalities, helping improve function. And if function has been compromised, providing the space and the support for the body to find a way to recover and cope and adapt and find a new normal, right? So the other camp then is it's a more generalized focus that addresses these issues um, in a totality or whole person client-centered care. And it is absolutely as important, if not more important, than the idea of a focused find and fix, which really, if there's pathology present, it really should have, and we identified it as massage therapists, we really should be referring and consulting because we can support each other. Uh, Professionals working together, that's the wonder of an interdisciplinary care approach, is that we're looking at the whole, but there are many professionals that can be involved in that. So if somebody has got some sort of a pathological condition that is being treated medically, yeah, and or through chiropractic and or through physical therapy, um, massage can play an important part there. We may not do the same methods, but we certainly can be supportive and make sure that those methods have their best chance of becoming an integral part of how the person improves. So part of working in the health and wellness arena is that we have to be skilled enough to recognize when we should be part of more of an interdisciplinary approach, how we know how to consult, but also realize we don't have to do what they do as if we refer and become part of the care plan. We need to learn we need to understand what they're doing and how we adapt so that between both types of care, the person has the best chance of finding that new normal for them. Our strength as massage therapists is as in the whole person approach. Um, and we want to understand how assessment falls into your whole massage, your history, your general discussions with the client, how you begin the massage, how you let the person become comfortable with you, all of your touches, palpation, your joint movement, active and passive, how you watch the person move on the table, how you position them from supine to side lying to prone, or however you do that. Uh, all of that is a sifting through and going, okay, what's working well for this person? What could use a little help? Is this something that is within my scope of practice? Is this something I need to have other professionals be a part of this? And then seek that out through consultation. Um, and so it's not one or the other. And our uh, whole approach, the familiarity with it, the way we look the same and act the same, and the room is set up the same, and the music is similar, and the environment is inviting, and the massage has a specific beginning, middle, and end that there's a respect. We're not abrupt. We certainly adapt to multiple situations all the time, but we don't lose the context of what we do and what we provide. I put a mentoring tip up that says if we continue to make massage something that it isn't, then we lose what it is. And I don't want to see that happen. And the wellness movement, the movement toward wholeness in health and medical care is providing a rich environment for us to thrive. And we don't have to become something we're not, but we do have to become excellent at who we are. Just think on it.